Hello and welcome to the presentation on superior labral anterior posterior, also known as SLAP tears. And I am Shannon Rowe. I'm a doctorate student at Indiana State University, and today I'm going to just give you a basic overview of a SLAP tear and everything that goes into it. And first, I would like to begin by just giving a disclaimer that these are the views specifically for educational purposes. If you feel that you have the described injury from today's talk, please seek medical attention. So first, let's talk about what an athletic trainer is. An athletic trainer is a multi-skilled professional who collaborates with physicians and other healthcare providers, including prevention, examination, diagnosis, treatment, rehabilitation for emergent, acute, or chronic injuries. Athletic trainers also provide medical services to all types of patients, not just athletes. So anywhere from an industrial and also just in the general population in the public. Athletic trainers are also able to reduce and shorten rehabilitation time for their patients. So that's one of the big aspects of an athletic trainer. Superior labral, anterior and posterior SLAP tears are the tearing of the superior aspect, the top portion of the labrum in the shoulder. If you look to the picture to the right, you can see that at the very top of the glenoid, which is a part of the shoulder, is being teared, ripped, lesion. Any of these terms will be used interchangeably with this injury. So the tear begins posteriorly and then continues along the rim and then to the front or anterior aspect of the shoulder. So SLAP tears also have the involvement of the biceps tendon. So again, if you look to the picture to the right, you can see that there's a structure coming from the top and entering at the very top aspect. That's the biceps tendon. So usually the biceps tendon has a big role in a SLAP lesion or SLAP tear. There also are several different classifications of SLAP tears. Know that there is anywhere between, there's at least 8 categorized by researchers, but there are some subdivisions within those classifications. So how do SLAP tears occur? Well, it occurs when there's a shift in the shoulder and a combination of max shear, tension, or stress on the labrum. There's 2 main types of causes for this. One is the peel back mechanism, where a maximum shear force at the biceps is anchored at the labrum and then peels back of the labrum, causing labral failure. So there also has been seen to have SLAP tears with excessive external rotation of the arm, commonly seen in overhead sports. And then you can also have experience or have a SLAP tear when you fall on an outstretched hand. And then also, again, like I said, any repetitive overhead movement, having that your arm above your head creates less space and more pressure on those structures discussed before. So risk factors. A huge risk factor for getting a SLAP tear is participating in sports with repetitive overhead motions. Like I said earlier, pitchers, they have a more likely to experience a SLAP tear. Also, you're at risk if you have shoulder instability. Having that unstable shoulder will also create more stress on the labrum. And then if you have an increased external rotation with mostly a deficit comparing to your other side of 25 degrees. So signs and symptoms: if you feel that your patient or you may have a SLAP tear, patients would be experiencing pain with overhead activity. They'll also use terms of painful catching, popping, clicking, snapping in their shoulder. Patients who are athletes or throwers or anything overhead movement, they feel like they're have a dead arm, where they're decreased velocity or performance. So they're not getting as much power behind their arm as they used to. Signs and symptoms: also feeling like unstable, feels like their shoulders moving around a little, not as suctioned in there, if you will. And then older patients in an older population who are experiencing signs and symptoms of a slap tear are more likely to have a coexisting rotator cuff injury. So anything with internal or external rotation would be also painful with this injury. And then as well as anterior shoulder pain. So pain in the front part of your shoulder that would be also a painful sign or symptom of a slap tear. So immediate care and treatment of a slap tear would be rest, rest from any aggravating activities, and then there are different ways to examine it. The gold standard, so the recommended is arthroscopy, which is a surgical procedure, but there's also, you can do x-ray, which will show you the bones and kind of more rule out any other possible fractures associated with the injury. And then an MRI is also used as a non-invasive procedure to examine the labrum. Now there also is the non-steroidal anti-inflammatory drugs, or NSAIDs, to assist with pain. So this is your general over-the-counter of ibuprofen or acetaminophen, anything to help assist with decreasing pain and inflammation. And then you can also apply ice to the area to decrease in swelling or anything like along those lines if it is an acute injury and there would be possible swelling. So what to expect. Once the patient has most likely have a slap tear or been diagnosed with a slap injury, there are two ways to go about it. There's a surgical invasive approach and there's a conservative non-invasive approach. So when doing the surgical approach, the patient would be undergoing arthroscopic surgery. After surgery, they have 3 weeks of immobilization, where they're just in a brace or a sling, complete rest. At weeks 4 to 6, they can then begin range of motion, but still staying underneath 90 degrees of flexion or abduction. And then weeks 7 through 12, the patient can then be beginning their full range of motion, increase shoulder strengthening of rotator cuff, and then continuing to weeks 12 and 16, the patients can then return to their activities of daily living. Now, months 4 to 6 is more sport specific for patients who would wish to get back to collegiate or competitive sports, anything along those lines. Your patients between the months of 4 to 6 will then begin those more high velocity overhead throwing, swim, more excessive, more powerful movements. Now with the conservative approach, it's not as time consuming, if you will, but it is a lot more dependent on the patient. So the patient will, as soon as the injury occurs, they'll be resting, and don't do any aggravating activities to enhance or worsen any of the current pain that the patient's already experiencing. Once pain has subsided and the patient is able to continue with exercise, they can begin exercise. So with the exercise, it'll be progressive range of motion to where they are comfortable, and then continue on to progress from there, as well as stretching and other therapeutic exercises. Now, when looking to decide between a surgical approach and conservative approach, a lot of research does suggest that surgical approach is the best way to go. With the conservative approach, as much as you can strengthen the surrounding structures, the labrum will still have a tear or rip lesion in it that would, when stressed, will still experience failure. Where the surgical approach has a higher likelihood of returning back to all expected previous activities before the injury. Now, if you have any questions or comments about superior labrum from anterior to posterior tears, please contact me, and I will be glad to answer any questions or dialogue and answer any comments. Thank you so much, and have a great day.